Go ahead.
Right. Thank you so much for joining us today, everyone. My name is Stephanie. I will be monitoring things here on the back end. Our neuroimaging summer series features neuroimaging faculty and affiliates showcasing their cutting edge research. Um, Today is our last neuroimaging summer series for the year. Thank you so much for joining us. It's been a pleasure putting on this series for everyone. I will be sending everyone an evaluation, so please fill out the evaluation. We would love to continue this series next year and with more exciting research. Um, with that, I am pleased to introduce Dr. Shruti Mishra. She's a tenure-track assistant professor within the Division of Neuroradiology in the Department of Radiology, who joined the faculty at University of Michigan in 2003. She received her undergraduate degree in bioengineering from the California Institute of Technology, her medical degree from Washington University in St. Louis, and completed diagnostic radiology residency at Brigham and Women's Hospital, Harvard Medical School, where she was in the clinician scientist research program. She completed a neuroradiology fellowship at University of Michigan. Her current research interests include validation of low-field MRI in neuroimaging and translation of quantitative MRI imaging biomarkers for the brain health with a focus on vascular contributions to cognitive impairment and dementia. She is a current member and participant in the Leaders Initiative within the Neuroimaging Core of the Michigan Alzheimer's Disease Research Center. She is also a recent inductee into the Research Education Core, our REC mentorship program. And with that, I will turn things over to you, Shruti.
Great, awesome. Thank you so much. And thanks to everyone who's joining. So the title of my talk is on probing white matter microstructure with diffusion-weighted MRI, with a focus on techniques and some applications in Alzheimer's disease and related dementias. So my only disclosure is that I do receive some partial funding support through the Alzheimer's Disease Research Center. And then I also will disclose that I'm not a physicist or a mathematician, but my intent is to distill down some important technical concepts in diffusion MRI for any scientific investigator looking to use these measures in their research. So my talk will start with an introduction to diffusion-weighted MRI with a review of principles and acquisition on a high level, and then discuss signal-based representation strategies. The two most common in the literature include diffusion tensor imaging and diffusion kurtosis imaging. And from there, I will transition to discuss biophysical modeling of diffusion MRI, specifically with discussion of neurite orientation and dispersion density imaging, or NODI. And then I'll transition from there to discuss some emerging methods and a new representation, thinking about biophysical models in the white matter as the standard model. So the goal of diffusion MRI is to get information about tissue microstructure, which is on the order of microns, from an MRI image, which is usually acquired with a spatial resolution several orders larger, with the voxel size on the order of 1 to 2 millimeters. And so how do we do that? Diffusion MRI makes use of principles of diffusion. Diffusion refers to the thermal motion of water molecules and is also referred to as Brownian motion. Einstein developed the mathematics theory to model diffusion as a statistical random walk experiment with a Gaussian distribution, and derived a formula that essentially related the root mean squared displacement for a particle as a function of the diffusivity, the time, and then a constant, which is determined by your dimension. So for a 3-dimensional displacement, that constant would be 6. And in completely unhindered environments, we know that the diffusivity of water is around 3 microns squared per millisecond. And in biological tissues, we know the diffusivity can be less than that. And so this allows us essentially to, at clinically applicable diffusion times, which can be on the order of 50 to 100 milliseconds, allow us to measure displacement that's on the order of tens of microns. So for those who are less familiar with MRI, in basics of MRI, that we measure signal through hydrogen protons of water molecules. And specifically, diffusion-weighted MRI measures the displacement of water molecules by using two gradients with strength G that are turned on for a period of time that's differentiated by this big delta. And that's turned on for a period of time that's defined by little delta and separated in time by big delta. And essentially, in the MRI environment, we start out with, in a static magnetic field, results in all protons starting out by having identically aligned spins. Application of these two gradients differentiated in time differentiates protons that are freely moving, aka those that are in an unhindered environment, compared to molecules or protons rather that are not freely moving and are hindered in some way. And the degree of which that diffusion sensitization is reflective in this value called the B value, which is a function of the gradient strength, the big delta, the time between the two gradient pulses, and then the little delta, the period of time that that gradient pulse is on for. And this figure gives you a look at what the raw images look like at different B values. So an image that has no diffusion weighting, aka will be referred to with a B value of 0. You can see that the water molecules in the cerebrospinal fluid, which are completely unhindered, look bright. And as we add diffusion weighting with, for example, a B value of 1000, the signal in the completely unhindered protons, aka in the cerebrospinal fluid, goes away. And then as we get to even higher levels of diffusion weighting with a B value of 3000, we really select for the protons that are in the most hindered environment. So on this particular image, that would be reflective of protons that are in an ordered white matter tract, for example, the posterior limb of the internal capsule where the corticospinal tract fibers run. Measuring diffusivity of a voxel, which is designated as the apparent diffusion coefficient, requires measurement of our signal on a voxel level with at least two B values. And usually the reference B value is 0. And on clinical acquisitions, for example, when we're looking for acute stroke or tumors, that the second B value is usually something like 800 or 1000. And based on these equations, we can come up with a relationship for the diffusion coefficient as a function of the signal in this negative log scale, as well as a function of the B values. And so, but the ultimate goal of diffusion MRI in this context, in a research context, is not necessarily to just compute the diffusivity, but to reduce the signal into some kind of quantitative parameter that reflects microstructure that we can analyze and then therefore interpret to measure a disease state. And the parameters that we receive or can be left with are very highly dependent on the signal model or representation that you use when looking at the actual signal. So the two big modeling strategies for diffusion-weighted MRI can be divided into two big buckets. The first broad umbrella is signal-based representations, which essentially are formulas which describe signal decay. And these are in theory applicable to any tissue type because you're not making huge assumptions about how that particular tissue is ordered. And they're believed to be highly sensitive because you're using the majority of that data in your signal representation. But the primary drawback is this lack of specificity, that the parameters that you're measuring don't really have a true biological correlate. And so more recent strategies include using biophysical modeling. And this implies using a simplified schematic or making some assumptions through a simplified schematic of the tissue where the water is diffusing that you are trying to measure. And so therefore this is by definition tissue specific. and has therefore better specificity and a potential to yield parameters that better characterize the microstructure in a biologically meaningful way. But the primary drawback is that they're highly dependent on the assumptions that you make, both about the underlying schematic and then further assumptions that usually have to be made to make the fitting quantitatively feasible, as we'll talk about. So diffusion tensor imaging is the quintessential signal-based representation strategy. It models molecular motion as one would expect for a freely diffusing molecule obeying a Gaussian distribution, which means that if you have molecules that start out in a particular distribution, after some period of time, that those molecules are going to spread out and kind of remain in that Gaussian distribution. And it's been shown that for freely diffusing water molecules, overall, a Gaussian distribution is a valid assumption at sufficiently low B values. So another way of seeing or representing a Gaussian distribution is saying that equation that I showed earlier, where the log relationship of the signal as a function of the B value could be fitted with a linear estimation or a linear fit. DTI makes the assumption that the diffusion in biological tissue has directionality and therefore models that anisotropy using the shape of a 3D ellipsoid. And in order to describe an ellipsoid mathematically, one needs 6 unique values. Those are defined by the 3 vectors that reflect the 3 directions of the ellipsoid and the lengths of those vectors, or in other words, the eigenvalues. And therefore, to model diffusion, you need to, at the very minimum, have to acquire diffusion measurements along a minimum of 6 gradient directions. So the parameter estimation from DTI is relatively straightforward and easy to understand conceptually because they're directly derived from these eigenvalues. The most common ones that are reported in the literature reflect our mean diffusivity and fractional anisotropy, but you do also see papers that will report radial diffusivity and axial diffusivity. And as you can see, the kind of equations tell you exactly what you're measuring. So the fractional anisotropy is a measure between 0 and 1 that is reflective of the degree of anisotropy. So this is going to be a higher value if you have one of these lambda, like lambda 1 being substantially higher in value than lambda 2 or 3. If you're in a voxel where there is relatively low anisotropy and these values are close together, in other words, it's more spherical in shape, your fractional anisotropy is going to be lower. And mean diffusivity, which is the other very commonly reported parameter, is an average of your lambda 1, 2, and 3 in the 3 different directions, and it's just an average of them. So while signal-based representations like DT are not specific to any tissue, the fundamental modeling using a 3D ellipsoid is based on the prediction that there is some anisotropy. Therefore, evaluation of non-anisotropic tissue, for example, gray matter, really may not provide the most accurate estimate of microstructure, even though it is frequently reported. So there are hundreds of studies which have evaluated DTI and AD because it's been around for decades. And so I'm just going to be highlighting just a handful of studies that kind of highlight different aspects of ways people have looked at diffusion microstructure in Alzheimer's disease. So this was a study that included 46 Alzheimer's disease patients who had undergone an ante-mortem DTI study and post-mortem underwent Brock neurofibrillary tangle staging at autopsy. And so for those who may not be aware, Brock is a semi-quantitative staging of neurofibrillary tangles at pathology, where stage 1 and 2 refer to neurofibrillary tangles confined mainly to the entorhinal region, and Brock 3, 4 indicate involvement of limbic regions such as the hippocampus, and then stage 5, 6 reflect more extensive neocortical involvement. So in this case, they divided their patient cohort into 2 groups based on the degree of neurofibrillary tangle staging that was seen on autopsy, essentially a group that had a low NFT stage 1 to 3 and a group that had a high NFT stage that were pretty close in number, and did a voxel-based analysis. They looked at both fractional anisotropy and mean diffusivity between these 2 groups. And you can see that overall the regions where they were that had highest discriminatory power between these 2 groups were in white matter regions in the temporal and parietal lobe white matter, and they were particularly in ventral limbic connection regions, which is maybe what you would expect um, uh, for an analysis like this. And they found significance in the ventral cingulum tract, the cruce of the fornix, as well as the entorhinal white matter and the precuneus white matter. And then when they looked at some of these white matter regions and looked at the fractional anisotropy, which is shown in, I know this is somewhat small, but hopefully you can appreciate it, is the first column. And the second column reflects mean diffusivity values in these regions. They found that on average, there was a decreasing fractional anisotropy corresponding to higher Brock stage, and correspondingly higher mean diffusivity with higher Brock stage. And they also found that these relationships, the similar relationships with worsening cognition on the premortem neuropsychic valuations. Looking at group differences, I chose for this because there have been so many studies that have evaluated this to just highlight some meta-analyses. So this was a meta-analysis that included 41 DTI studies that had a total of 2,000 participants. And you can see the breakdown in participants who had Alzheimer's disease, MCI, or who were normal controls. And because this was a meta-analysis, they included regions that were reported by at least 3 studies. And it was heterogeneous in that some were whole lobar white matter regions, some that were defined by the anatomy, the genu and splenium of the corpus callosum, posterior limb of the internal capsule, and some that were derived from tractography, the cingulum bundle, superior longitudinal fasciculus, and uncinate fasciculus, and then also looked at, they did include one cortical region, the hippocampus. And they essentially here in these graphs show basically effect size of fractional anisotropy and mean diffusivity in these different regions. If there's no bar there, it means that there was not a statistically significant relationship. And they overall saw that there were some moderate to high effect sizes for various regions in discriminating AD versus normal controls and mild cognitive impairment versus normal controls. And overall, this broadly showed that DTI has sensitivity to detect group level differences in different white matter regions. And despite my early caveat of, DTI may not be the optimal method to use to really look at gray matter, there have been many studies that have attempted to use essentially basically mean diffusivity as a microstructure measure in the gray matter, and to compare whether or not that has improved ability, discriminatory ability in different patient groups compared to volumetrics alone. And this large meta-analysis, which had aggregated 76 papers that had included measures of atrophy, and their measures of atrophy were volume measurements in the hippocampus, entorhinal cortex, or parahippocampal cortex, and the score called the medial temporal atrophy score, which is a visual score based on subjective assessment of the medial temporal lobe. And they had compared effect size, and then also had 55 of those articles had DTI. So kind of, again, a large number of participants that they aggregated, but because of its meta-analysis nature, it did have a somewhat heterogeneous group of regions, some that included lobar white matter, some that were tracks that were derived from tractography. But big picture, this, if you just compare, the bold lines reflect where they had a statistically significant relationship. You see that the effect sizes for mean diffusivity in really many of these ROIs were much lower than the effect sizes for the actual volumetrics. And so the study, kind of may confirm one's intuition that DTI parameter measures in cortical regions did not add value compared to simply volume measurements and differentiating between these populations. Cerebral small vessel ischemic disease has also been studied by nature because it's characterized more by white matter abnormalities. Cerebral small vessel ischemic disease is characterized on conventional imaging by the presence of white hyperintensities on T2 weighted imaging, and also referred to as white matter hyperintensities, lacunar infarcts, enlarged perivascular spaces, microhemorrhages, as well as atrophy. And we know from the literature that white matter hyperintensities are overall nonspecific. They can be seen in cerebral small vessel disease as a result of cardiovascular uncontrolled cardiovascular risk, but it can also be seen in Alzheimer's type dementias, and overall don't correlate well with cognitive impairment. So there has been some interest in looking at seeing whether or not DTI or measures of microstructure from diffusion would provide a better estimate for cognition. So there are a couple studies that I'm highlighting here. One was a multi-site study with 115 participants who did not have a known dementia diagnosis, and they had white matter hyperintensities that were moderate or severe using this Physicus score, which is a grading system for degree of white matter hyperintensity in the white matter. And they looked at diffusion measures and overall found that diffusion measures from normal appearing white matter were better predictors of both executive function and processing speed impairment compared to white matter hyperintensity volumes. And they looked at, and they saw those significant relationships with both fractional anisotropy measures, mean diffusivity, as well as radial diffusivity. In a separate study, they're kind of a similar, again, multi-site study that was part of this like PRESERVE trial. They looked at diffusion measures, both in normal appearing white matter and white matter regions, and in basically different measures they looked at global cognition and processing speed, and overall found that diffusion measures, particularly in this study, they were focused more on fractional anisotropy and mean diffusivity, were better predictors of processing speed impairment compared to white matter hyperintensity lesion load, which were not significant in their models. So we talked a little bit about, DTI, but when is it really not valid? And so we taught DTI is not valid when water diffusion is not Gaussian, which we know is true when you get to higher B values. And then we also know that it's cannot be valid has less validity when the diffusion is not inherently anisotropic, or when you have different where you may not have one dominant direction of anisotropy, which would be the case in the case of crossing fibers. And then in gray matter, because but based on we just know that there's just inherently less anisotropy in the gray matter compared to the white. And so diffusion of water, and then overarching, we also know that everything about DTI, everything that I've kind of explained to you so far is based on these assumptions, based on freely diffusing water. And overall, we know that in diffusion of water in biological tissue is not Gaussian compared to free water. And so, in this one of kind of the earlier in vivo studies, looking at that log signal relationship versus B value, you can see that in white matter and gray matter, both there is a deviation from that linear relationship, especially as you go up to above a B value of 1000. The range on this on the x-axis here, 0 to 4000. And per white matter in particular, there is a greater deviation kind of away from that linear relationship as you get to those higher B values. And so diffusion kurtosis imaging was sort of defined as an attempt to account for the non-Gaussian diffusion of water. So previously, when I showed you that figure of Gaussian distribution after some time, particles sort of freely diffusing, resulting in a wider Gaussian distribution, diffusion kurtosis results in diffusion that has basically either a slightly more peaked distribution or a slightly wider distribution. And this is based on a quadratic expansion of this log signal relationship. And overall, we know that it provides a better fit of the diffusion signal at higher B values, especially as you get to B values above 1000, as you can see in this, which compares, your measured diffusion data, kind of like I showed you in that previous graph, the linear fit versus, what happens if you include this kurtosis term. So the kurtosis tensor has a much more complex morphology than the Gaussian diffusion tensor that I showed you for DTI earlier, and requires therefore much more diffusion data to do that fitting. So it does require a minimum of 2 non-zero B values, where you have to have a B value that's somewhere in this range of above 1000. And typical protocols will have that B value be 2000, and also requires a minimum of 15 gradient directions that are done at higher B values. But and understanding the diffusion kurtosis imaging parameters is a little bit more complex compared to DTI, where it's sort of a natural extension of understanding a 3D ellipsoid. But visually, you can see here, so the values, parameters that result are, in addition to what you would get from DTI, you get a mean kurtosis, axial kurtosis value, which essentially is the kurtosis in the direction of maximal, anisotropy in the dominant diffusion direction, and then radial kurtosis reflects the kurtosis in the perpendicular direction. These have been postulated to be measures of tissue heterogeneity. In other words, where you see higher kurtosis reflects where water molecule diffusion deviates the most from Gaussian distributions, and it has a potential to improve estimation, particularly in gray matter and fiber crossings. So in this early study that has like fractional anisotropy on the y-axis and kurtosis on the x-axis here, you can see that both gray matter and fiber crossings have similar FA values that are low, but kurtosis is allowed to, it has the ability, it differentiates those ROIs. One thing that is important to note is that in areas where there is a high degree of anisotropy, so in other words, where you are potentially in a highly ordered white matter bundle, fractional anisotropy may still provide kind of the better estimation in that location. So various studies have sort of evaluated whether or not DKI's potential for improved assessment of microstructure in cortical areas may prove to have some biological significance. And so in this study, they're looking at including 20 AD patients, 20 patients with mild cognitive impairment, and 20 normal controls. They basically found that mean kurtosis, hippocampal and they also they looked at hippocampal volumes, mean kurtosis, mean diffusivity, and fractional anisotropy from DTI, and found that hippocampal volume was just discriminatory between Alzheimer's disease, the AD and MCI cohort, but not the normal control and MCI. And in this sample, mean kurtosis was the only estimation within the hippocampus where it had discriminatory ability between normal controls and MCI. FA did not have significant relationships in either hemisphere, and mean diffusivity only differentiated AD from MCI or normal controls. And so this study suggested that perhaps the kurtosis measures may provide a more sensitive evaluation for discriminating populations that are kind of in that early stage, like normal control versus MCI population. There have been other studies that have also looked at deep gray matter structures. So in this study, this was a study that did free surface segmentation. They had 18 AD, 18 MCI, and 18 normal control participants, and did free surface segmentation of deep gray matter volumetric structures that included the thalamus, your basal ganglia structures, caudate, putamen, globus pallidus, as well as temporal lobe cortical regions, the hippocampus and the amygdala. And they averaged across hemispheres, and they found that mean kurtosis was more sensitive in detecting group level differences between between MCI and normal controls, as well as Alzheimer's disease and normal controls, as evident compared to a volumetric analysis alone. So you can just see like the regions that are colored here reflect regions where there was a significant relationship, and there are more of them in the mean kurtosis figure. But interestingly, in this small sample size, they found that mean diffusivity, when they did a cortex, like a voxel-wise analysis, discriminating MCI versus normal controls in the small sample size, they found that mean diffusivity had a much larger kind of spatial distribution, where there was sensitivity for group level difference detection compared to mean kurtosis. So these highlight that despite that certain hypotheses that one may have based on the theory of a diffusion technique or from ex vivo experiments, that extensive validation in different cohorts needs to be done in vivo to really understand which one of these measures will ultimately or is the most important. So the relative lack of specificity and biological understanding of the deviations, in fractional anisotropy or mean kurtosis has really resulted in a result shift towards biological modeling of diffusion data due to the promise of better specificity. And so this is a part where I say, this is my understanding as a non-mathematician and physicist to really try to understand some of the basic principles that underlie many of these advanced diffusion techniques. And so the basic principle of many of these advanced methods is that there are really two effects that are contributing to the macroscopic voxel level diffusion signal, which is the microscopic diffusion process, which is referred to as the kernel. It's sometimes also referred to as the response function. And in the context of white matter, this is the structure at the level of the axons. And this is informed by the biophysical model, by the assumptions that you're making about the underlying tissue. And the second process is really your mesoscopic structure, which reflects how these bundles of axons are arranged within a voxel. And that's reflected by the fiber orientation distribution function, which can have various forms. And these two frameworks are mathematically connected through a spherical deconvolution. So in other words, if many of these models make an a priori assumption on what the fiber orientation distribution function is or what form it can take. And then what the what compartments are in the actual biophysical model on a microstructure level. And that is presumed to what gives you your diffusion signal. And so therefore you can perform spherical deconvolution to then retrieve the fiber orientation distribution function, and which can be used for tractography, which I'm not getting into in the interest of time today. And the kernel is the model based on the assumptions of the tissue microstructure, and that gives you your parameter estimates for microstructure. So how do we understand that framework or principle? We'll start with NADI, because if you're someone who is engaged in diffusion MRI or just participating or listening to the literature, you've definitely heard of it. And so NADI, it has popularity within the literature. It stands for Neurite Orientation, Dispersion, and Density Imaging. And it uses a 3-compartment model in that, kernel or in the response function. And it was created by the folks who wrote the original paper to be a clinically feasible implementation really for both white matter and gray matter. And so the idea with their 3-compartment models that there's an intraneurite compartment, an extraneurite compartment, and then a CSF compartment. Your intraneurite compartment, in the context of white matter, would be reflector axons, and it is modeled as 0 radius sticks. Your extraneurite model compartment reflects, your extraaxonal space, which usually has a variety of different types of glial cells and is modeled as a Gaussian anisotropic diffusion tensor. And then your CSF compartment is modeled as isotropic diffusion. And then the fiber orientation distribution function, which reflects that mesoscopic structure level, which is thinking about how these axons are arranged within a voxel, is represented by the Watson distribution. And the reason the authors chose this distribution is because its primary advantage is that it's defined by one parameter. So, with one parameter, you can go from essentially, having a fiber distribution that is spherical, in other words, not having any anisotropy, versus having something that has like this figure 8 shape, which has that kind of highly ordered anisotropic appearance. And so this decision was really made from a computational standpoint, because being able to model a fiber orientation distribution with just a single parameter makes the fitting much more computationally accessible. And so the parameters that are yielded include the intracellular volume fraction, which because it's an estimate of what's going on in the intraneurite compartment, people also use it to use the term neurite density index. CSF volume fraction, which is essentially kind of coming from that CSF compartment. And then your orientation dispersion index, which is computed from the orientation distribution function. And so there have been various studies that have looked at comparing net metrics that you get from NADI with what you would get from your signal-based representations like DTI and diffusion kurtosis. And several studies have found that NADI measurements have potential to be more sensitive to aging, but there has been a lot of heterogeneity in the literature about what that most important parameter would be. So in this particular study of 47 participants, relatively younger cohort of 18 to 55, they did an ROI analysis as well as tract-based spatial statistics, where you kind of do a voxel-wise tract-based analysis. And they essentially found, for example, I think what I've shown here first is the TBSS data showed that the green voxels, if I'm remembering correctly, yes, the green voxels defined the actual fiber tracts, and then the blue voxels reflect areas where there is a negative relationship, and the yellow-red voxels reflect someplace where there's a positive relationship. In other words, and then so basically these figures show that with increased aging, that there is a decreasing FA in the white matter, and with increased age, there is an increase in the orientation dispersion index. In other words, there's increased dispersion. And the spatial distribution where those age effects are seen are greater in this ODI map compared to the fractional anisotropy. And their ROI analysis kind of showed something similar. They derived ROIs from the JHU or Johns Hopkins White Matter Atlas, which you may be familiar with, and essentially showed ROIs where there was a significant relationship. You can see that there were more regions where there was a relationship with aging for ODI compared to FA, and the percent. They also computed a rate of change, even though it was from cross-sectional data by decade, and found that the rate of change in their population was also greater with ODI compared to fractional anisotropy. So all of this suggests that maybe orientation dispersion index from NADI may be a more sensitive measure of aging compared to what you would, compared to fractional anisotropy. But this is another study, and actually in this study, they looked at a number of different diffusion methods, some of which I haven't discussed in detail, including MAP MRI and tensor distribution function, which is an extension of DTI, but one that allows you to have multiple tensors or map multiple tensors in a voxel to help solve for the crossing fiber problem, and essentially found in this study, so TDF reflects tensor distribution function, and MAP MRI, again, these are other techniques. Of all of these techniques, though, NADI is the only biophysical model. These other techniques are still considered signal-based representations. And you can see here that looking at the corpus callosum, for example, that the relationship or the NADI metric that was most sensitive to age was actually the isometric volume fraction, or in other words, the CSF fraction. So this goes to show that we still have some ways to go in trying to understand which one of these parameters may be the most important in different, particularly in different contexts. Looking at relationships with cognition in this study with 99 healthy older adults that were aged 60 to 85, they used fMRI to derive had participants do a working memory task in the scanner and then use those bold maps to arrive at white matter masks that were created, derived from that, and then looked at diffusion metrics in those white matter regions and looked at the relationship between diffusion metrics in those regions and their ability to predict working memory performance. And as you can see, they included fractional anisotropy. They looked at free water estimation, which is also kind of an extension of DTI, where you account for the CSF, and then they compared NADI metrics, and in this they found that the intracellular volume fraction, or in other words, the neurite density index, was the metric that, or measure parameter that was most sensitive to predicting the working memory performance. And this study kind of in a different context, again, a different cohort. This was these participants were just derived from the Wisconsin Registry for Alzheimer's Prevention. So they're 383 cognitively unimpaired older adults, but they are derived from a cohort of middle and older aged adults who are at increased risk for Alzheimer's disease due to a parental history. And they looked at these, I think these were manually derived, if I'm remembering correctly, these 4 regions: the genu of the corpus callosum, splenium of the corpus callosum, and then they divided the cingulum into the cingulum bundle projections to the hippocampus in blue, and then the cingulum adjacent to the cingulate cortex in green here. So projection fibers going to the hippocampus, and then fibers that are adjacent to the cortex in those 2 different colors. And then looked at the mean diffusivity in these different regions, as well as neurite density index. I think they only included ones where there were 1 or more significant relationships, which are shown in italicized font. And you can see that the one where there was the largest effect size was with the neurite density index, particularly in the cingulate cortex region, predicting executive function. And so again, so again, some of these studies basically show in different contexts that some of these NADI measures may be more sensitive for detecting cognitive impairment compared to our signal-based representation. But the literature is not 100%, and this is a different context. Again, a group looking at cerebral small vessel ischemic disease. They looked at older adults who have white matter changes, are believed to have sporadic small vessel ischemic disease, and then a cohort who are believed to have genetically defined small vessel ischemic disease. In other words, they have a condition called CADASIL, which is defined as cerebral autosomal dominant arteriopathy and subcortical infarcts and leukoencephalopathy. It's a long it's a long name, but for those who may be not familiar, you can think of it as like a genetic version of getting small vessel disease. So these patients at much younger ages without cardiovascular risk factors get lacunar infarcts and white matter hyperintensities. And so in this study, they looked in these two different patient cohorts, looked at DTI measures, kurtosis measurements, as well as NADI measures. And overall, the color scheme basically is that the darker blue reflect basically a larger component of the variance. So in other words, like you can think of it as like it has a larger effect size. The circles reflect the degree of significance based on the p-values. And just visually looking at it, you can get a sense that the kurtosis measurements in this particular group had stronger relationships to processing speed in both populations compared to NADI. So this all goes to show that there continues to be some heterogeneity in the literature about, what is the best approach to go. And they did a voxel-wise analysis, which yielded basically similar results. So I'm going to move on in the interest of time. So I kind of went through some basic principles of these more advanced models, and then we talked about NADI. But the important thing to know is that there are many biophysical models out there, and so now the culmination in the diffusion literature world is moving towards taking a lot of this knowledge from the last 2 decades and kind of creating a multi-compartment model that sort of includes what we've learned from all of these other models, and have proposed this framework for a unifying strategy called the standard model for white matter. And it essentially, there are going to be some things that you've kind of already heard of, is again thinking about you're creating a model for your microstructure, and then having a fiber orientation distribution function which reflects how those how the fibers look at the voxel level. So the proposed framework is essentially that you have elementary fiber fascicles that are defined as kind of in 2 compartments, the intraxonal space and the extraxonal space, kind of similar to what we talked about, intraneurite, extraneurite. And variably, CSF is sometimes also included as that 3rd compartment. And the intraxonal space can be divided into 2 parameters, where you model your intraxonal space as these, again, sticks with 0 radius, and which have an intraxonal water fraction, which can be thought of as, your axonal density. It can be thought of like you would think about the neurite density index from NADI. And the intraaxonal diffusivity, which is the diffusivity within your axon. And then your extraaxonal space being divided into radial diffusivity and axial diffusivity, reflecting diffusivity in the parallel direction or perpendicular direction to the dominant fascicle. And in some early data suggests that these values, the radial diffusivity and parallel diffusivity, may be reflective of demyelination and neuroinflammation. So in other words, they might give us some more information about kind of the underlying components of the microstructure. And so this is a really busy slide, but I really wanted to provide some context of like, okay, we have all these models, like how are they different? I spoke a little bit about NADI, and we talked about how NADI has an intraxonal, extraxonal space and CSF space. But in the context of thinking about, well, how does NADI fit in the standard model? NADI, because even though it's very popular, provides several constraints on these diffusivity values that I mentioned. So it makes an assumption that the intraaxonal diffusivity and the extraaxonal parallel diffusivity are the same, and they're fixed to a particular value for adult patients. And there's a different value that they've defined for pediatric or like younger age groups. And then the perpendicular diffusivity and the parallel diffusivity are kind of related in this type of relationship. And then like we talked about, the fiber orientation distribution takes that Watson distribution for the purposes of increased parameter estimation. And so what this results in is that these constraints that are put on these diffusivities results in a decrease in the number of parameters that we're actually left with left with in terms of being able to define or measure the microstructure. And so I've included a number of other white matter, some other biophysical models that have been defined in the literature that have that kind of are part of this overarching idea that there's like a two-compartment model. But again, they make different and in some cases opposite assumptions about what those diffusivity values are. And so previously, and these were all done for a reason because multiple prior studies have shown that the use of maximum likelihood estimation techniques for the standard model essentially doesn't work well numerically and results in unstable estimation results. So essentially, these constraints that have been put on previously were done for in order to result in something that is more computationally feasible. But recently, machine learning methods allow for standard model estimation without some of these constraints, and have been shown to have some promise in clinically feasible protocols where you're just, maybe getting two non-zero B values. And so, what's an example? So this is a recent study that was published that basically looked at a correlation. They took simulated data from a clinical diffusion MRI protocol, added in noise, and then did a correlation between the ground truth of these estimates, correlation between the ground truth plus the estimate when they kind of ran several of these different biophysical model estimation, and found that the SMI here is reflected of the standard model using machine learning based estimation essentially provided the best sensitivity and specificity. The way to interpret these sensitivity specificity matrices is that in the ideal world, you would have an identity matrix, where all the diagonal elements reflect the ability for a particular parameter to quantify its own change, and off-diagonal elements reflect spurious correlations between parameters. And then, of course, there are some parameters that are not present in some of these because those parameters are constrained in the model. And so this suggests that parameter estimates that are yielded by the standard model may be more valid than some of these by other models where we provide where there are constraints that are put in. However, again, in vivo validation of this in actual patient and participant cohorts is yet to be performed and is some of the focus of what my work is going to be here in the MADRC in the next couple of years. So with that, I just wanted to kind of do a little summary. So we talked about diffusion MRI as a sensitivity for tissue microstructure on the order of tens of microns at clinically feasible gradient strengths. We discussed DTI is predominantly a measure of Gaussian diffusion of water using that 3D ellipsoid. It's applicable in single B-value acquisitions. And we talked about how fractional anisotropy and mean diffusivity have advantages of being sensitive for white matter microstructure, but not necessarily specific, and it has questionable validity in the gray matter. Diffusion kurtosis imaging was kind of introduced to incorporate non-Gaussian diffusion of water. It does require more data, slightly longer acquisitions because you have to have multiple higher B-value data, and it provides estimates of tissue heterogeneity and possibly a better estimate for microstructure in the gray matter. And there's a trend in the field towards biophysical models with the promise of increased specificity towards components of microstructure. But there are many assumptions that are made. We talked a little bit about NADI because of its popularity in the literature, and which with the promise of greater specificity to biological meaningful components. But there is a heterogeneity in results, and something we didn't get into is that there are some studies that suggest these constraints that are put in the NADI model may take away from the underlying, reason that you go for a biophysical model in the first place, which is more specificity. And so some of these emerging methods, which maybe release some of these constraints and with machine learning methods may kind of may provide improved specificity. And so I think that's all I have. I open to any questions, and if you're interested in any of this or are interested in collaborating, I would be more than happy to please reach out to me.
And we have time for a couple of questions. You can either put your question in the chat or the Q&A, or if you raise your hand, I can give you microphone access and you can speak as well. So yeah, we have about 5 more minutes left.
Excuse me.
Okay, well, if we don't have any questions for Shruti, we can end this meeting a few minutes early. Please note that I did put the evaluation link in the chat, so please take your time to fill out the evaluation. This is our last neuroimaging series for the summer, and I'm looking forward to starting this back up next year. So we'd love to hear about topics that you want us to explore starting next spring. So thank you so much for coming. We have one little thing in the chat. Amaya says, thank you. That was great.
Awesome. Thank you.